My name is Patrick Wallis, and one of the courses I teach along with Eric Schneider is Human Health and History. The code is 454 if you're excited about it.
And the course really focuses on two really important questions. One is, how has human health changed over time? And the other is, how have doctors and societies tried to manage disease and ill health over time? And so we deal with really interesting questions about how people's health status has changed. Are they getting taller? How has mortality declined? What are the main drivers of ill health in the past? We think about medical innovation and how that's affected kind of people's health and the extent to which it is responsible for driving improvements in health in the last 150 years. And we also think about how societies respond to ill health, how they respond to epidemics. And we look at that from the Black Death all the way to the present, to the eradication of smallpox.
The thing that's really interesting about 454 for us as teachers is the research projects. It's a really unusual course. We run it with 2 research projects, 1 in each term. And the first is a group research project where we ask you and 2 or 3 other people in the course to work together to try and do a small and really original piece of research on any topic relating to health. And the second then, in the second term, is an individual project where you'll take a question that fascinates you and try and find something new about it.
And we've had some really fantastic projects, like really exciting, innovative ways of thinking about human health and history, from people looking at the effects of pollution in early modern London on health outcomes, to people looking at kind of how morbidity changed over time, so how people's sickness changed over time in a London hospital, to others who take a more kind of intellectual approach, who are looking at how the introduction of Western medicine in China in the 19th century shaped the way that Chinese medicine was perceived. And so these are really fantastic ways to kind of build on the skills that students are already beginning to learn in other settings.
So these are really unique individual projects. In the course, what we try and do is give space for them. So we take 3 or 4 weeks across the year to workshop with students, to give you individual guidance, but also to sit there in the room and really think about how to engage a problem, how to find some resources, and how to kind of pursue your own vision of what a great topic in health is.
The questions that we deal with in the course really are quite important to how we understand what's going on in the world today. And especially if we think about health as really being one of the most important components of people's living standards. It's really important whether you're sick or not. And understanding how people's sickness then and how it's changed over time is really important to understanding how human experience has changed over time. And there are some more direct kind of correlations as well. So, understanding how or what were the causes of mortality decline in Western countries in the past can help us understand what might need to happen in developing countries today to help eradicate those same diseases. We can also look at the way that societies have handled epidemics in the past to try to understand, how we can better handle epidemics in the future. And so there's a lot of kind of lessons that go from studying human health in history in the past to kind of understanding how the world works today.